Our last section for the class is on arthropods. The first group of arthropods we'll discuss are the Chelicerata. Often in here we talk about spiders, so spiders will be the first group, but there are other organisms that belong to this as well. Generally, Chelicerata have 8 legs, they don't have any antennae, and they have 2 body parts. So they have what's called a cephalothorax, so kind of a fusion of the head and thorax, and then they have an abdomen. Many spiders specifically, produce venom, and they kill their prey by biting. However, very few spiders have fangs that are long enough or strong enough to penetrate human skin. And the majority of spiders have venom that is incapable of causing severe disease. For the most part, spiders use their venom to kill insects. So there isn't a lot of overlap in the receptors that insects have for the venom and that humans have. However, there are some spiders that do produce venom that is dangerous to people. In the US, we have 2 native species of spider that have dangerous venom. There is a 3rd invasive species I've read about that's established in the Southern California, kind of Los Angeles area. With envenomation, it can be either systemic, meaning you will feel effects throughout your whole body, or it can be necrotic, meaning the effects are localized, significant tissue damage. Spiders that cause systemic arachnidism tend to be things like tarantulas or black widows. So black widow is shown here. Black widows are very, very common in the United States. I have one I know right now that's living in my garage that I have to go kill. Normally live and let live, but I have small children who don't know about the risks yet. So this is a black widow. Necrotic arachnidism is in the US caused by brown recluses. So this is Loxosceles. Again, I'm not great with Latin. It's the recluse genus. So the native species in the US is the brown recluse. There is an invasive species of recluse called, I think it's the Chilean recluse, that has established itself in Los Angeles. They're much bigger than brown recluses, but again, they're invasive. So with black widows, they produce a neurotoxin. Patients will generally experience sharp pain. At first, there will be no swelling, which will develop to a local redness, swelling and burning at the site of the bite. Patients can experience muscular cramps, chest pain, nausea, vomiting, sweating, intestinal spasm, visual difficulty. So you see why we call it a systemic arachnidism. It's a systemic intoxication. For most patients, symptoms will subside in about 48 hours. However, there is a low mortality rate, 4 to 5% of patients. There is an antivenin available. It's best if given shortly after the bite. So if you know that you've been bitten by a black widow, it's best to go to the hospital and seek some treatment right away. The antivenin is derived from horse serum. So if patients are allergic to horses, you actually can't give them the antivenin, so you should test them for sensitivity. Brown recluse and other recluse spiders, their toxin is a necrotoxin. It's hemolytic. And patients will have necrotic lesions with deep tissue damage. We don't actually have brown recluses in California. So if you are presented with a patient who has a lesion that is necrotic and looks like it could be from a spider bite, it almost certainly is not. It's almost always staph, at least in California, unless the patient has recently returned from the areas in the country where brown recluses are actually found. And again, I've actually had arguments with people about this. They get all nasty oh, it's definitely a brown recluse bite. It's definitely a spider bite. And I'm like, dude, it's staph. I don't know why you're so mad about it. Like, it's staph. That's much better. You can treat it with antibiotics. There was, at one time, the state of California was soliciting submissions of spiders because people kept saying, ooh, brown recluse, brown recluse. I saw a brown recluse. Like 600 spiders were submitted to the state. Not quite six, it was like 580 something, but whatever. Literally one of those spiders was a brown recluse, and it was from a family that had just moved here from Missouri. So it had been in their moving boxes. So we don't have brown recluses in California. The bite is initially painless. Within 3 to 4 days, a vesicle will slough off, leaving ulcers and radiating necrosis. It can spread for weeks to months. Generally, it's diagnosed by the lesion formation, which again looks a lot like a staph infection. If the wound hasn't healed within 6 to 8 weeks, excision and skin grafting are going to be the options here. Our next member of the Chelicerata are scorpions. This is a picture of a scorpion. They have pedipalps, which are a type of claw at the anterior end. They have 8 legs, and they have a hollow stinger at the end of their tail. This is how they inject venom. There are very few species that are able to cause painful and potentially deadly wounds, and I always specify in the US. In Australia, I think everything is trying to kill you, so I'm sure there's a scorpion in Australia that could like drop you dead in your tracks, but in the US, we don't really see that. They can produce neurotoxins, which again, you would see the systemic effects. They can also produce a hemolytic venom, which is pain, swelling, discoloration, and necrosis at the site of the sting. I typically haven't really seen scorpions on the valley floor. I lived in Fresno for like 8 years, 7 years, never saw a scorpion in Fresno. My mom one time saw one in her garage up by Turlock. So we see them in Texas, like literally all the time. They're just not as common on the valley floor. So the chances that you'll run into one may be pretty slim. You may have a patient, though, who says that they've been stung by a scorpion. And it's pretty easy to tell that it's like, if a patient says they were stung by a scorpion, they certainly were stung by a scorpion. Most patients know what a scorpion is. Now, the trick is there are antivenoms available, but that's only useful if the species of scorpion is known. So if the patient brings in the scorpion or has a picture of the scorpion or has a video of the scorpion, otherwise it's really going to be pain relief, cryotherapy to reduce swelling, something like that. So it's tricky to directly treat the envenomation if the species of scorpion isn't known. Our next member of the Chelicerata are mites. So mites don't really cause an envenomation, and they don't cause what we call an infection. Instead, they cause what we call an infestation. I don't think that sounds better, but it is what it is. So here's an image of a mite. They have a sac-like body. They have 8 legs, no antenna. In humans can be infested with Sarcoptes scabiei, which causes a disease called scabies. In animals, they'll get mange, which is caused by a different type of mite. The presence of mites and their secretion will cause itching. So this is what it looks like. You'll see the redness and swelling where the person has mites. It can be spread person to person through direct contact or through contaminated objects, and will be diagnosed by the presence of mites in the lesions. Usually you would do a skin scraping and look at it under the microscope to look for the presence of the mites. There is a topical treatment available. What we worry about here, we tend to not see scabies as much in adults, tend to see it more in children. And really what we would worry about is how itchy these are, that children will scratch and develop a secondary bacterial infection. So if you have children, plan to have children, just keep an eye out for something that looks like this and kind of a lot of scratching, because that can be indicative of the scabies infestation, which could potentially get infected. All right, our last Chelicerata are the ticks. Ticks, again, have two body parts. Here are our soft ticks. Here is a hard tick. On the soft ticks, it's sometimes harder to see the two body parts. On the hard tick, you can see the cephalothorax and the abdomen. They have 8 legs, and they have a 4-stage life cycle. So they'll have an egg, which will hatch into a nymph, which matures into a larva, which will mature into an adult. They can have multiple stages in there, but those are the 4 main stages. They all serve as blood-sucking ectoparasites. So they don't get into the body, they stay on the outside of the body. That's what we mean with ectoparasites. So we would contrast that with things like our unicellular parasites and our multicellular parasites, which are endoparasites that go inside the body. Most often we think of ticks because they are important for disease transmission. We've talked about a ton of diseases that can be transmitted by ticks. There are some ticks, however, that can cause what's called tick paralysis, where the body has a reaction to some proteins in the saliva of the tick, and as the tick is still attached, the patient will develop paralysis. Generally, we're talking about a hard tick, because these hard ticks feed for days. They'll be on the body for a really long time. These soft ticks, I always think of them as like little ninja feeders. They're in and out real quick. And the tick paralysis can be reversed by removal of the tick. So I read one story once about a dog, and you can Google this, like you'll find it. It was a dog that the owners, right, the pet parents, their dog just got progressively worse and worse and worse, and they were actually going to put the dog down. And when they took it to the vet to be put down, the vet found the ticks and removed it and was like, just give it like a day or two, and the dog was totally fine. So it was a tick paralysis. You can Google it, you'll find the story. One of the other weird things that can happen with a tick bite, especially people in the Midwest, if they get bit by a tick called the Lone Star tick, it can cause a meat allergy. Red meat allergy. Super, super weird. Very, very interesting ticks.